Good morning, judges. Let me introduce myself. I'm the 13th contestant of Student Skills Competition in Health and Social Care. Let me please join. First, tool preparation. The tools are prepared. Second, client preparations. Good morning, ma'am.
Good morning.
My name is Farah and I will take care of you today. Can you tell me what is your name?
My name is Mrs. Christina.
Okay, let me check your identity first. Your name is Mrs. Tristina, date of birth 24th March 1960, and your age is 61 years old. Is it right?
Yeah,
Okay, thank you. How are you today?
I'm well.
Do you still remember what day is it today?
No,
Okay, today is Tuesday, and for today, I will help you to do blood glucose test that can help us to monitor your blood glucose level, so we can make the next plan care for you. And after that, I will help you to take your medicine, doing the food care, and teach you about simple food cleaning. And after that, I will help you to change your linen because your linen looks unclean while you stay on the bed. It can make you feel more comfortable and it can make your bed look clean and tidy. And before I change your linen, I will help you to move into your wheelchair. Do you get what I have explained?
yeah,
If you get what I have explained, may I do it now?
okay.
Okay, let me prepare first. For all the guests, please go outside because I have to do some checks to the patient's condition. And for one relative, please stay here to accompany the patients. Close the door, window, and the scat cells. Turn on the lamp if the room was dark. Bring the tools closer to the patient's bed. Okay, ma'am. After this, I will start to do the blood glucose test. And before that, I want to ask you some questions. Do you have any problem with your conditions lately?
I'm hungry, sleepy, and numb, cold numbness.
Is your condition better than yesterday?
Concentration.
Okay.
No,
And have you ever been to blood glucose test?
no.
Okay. After this, I will explain it to you about how to do the blood glucose test. First, you have to prepare the tools. This tools is called lancet and this tools is pen lancet. So you have to put the lancet inside of this pen lancet. Like this. And after you put it, you have to take off the cap like this. And there is a number that indicate the depth of the puncture. The number 1 is the less deep, and number 5 is the deepest. And you can adjust it to number 3 like this. And now you have to prepare the glucometer. So this tool is called glucometer. First, you have to put these things on like this. And then you have to put the strip until these tools make a sound. And then it will show a symbol like drop of blood. That means this tool is ready to use. Okay, can you give me your hand? Excuse me. Thank you. After this, I will wipe your finger with alcohol swab. And now I will puncture your finger. It's gonna be feel a little bit hurt. Can you hold it for a while?
Okay.
Thank you. If you don't see any blood come out, you can massage your finger gently until some drop of blood come. Okay, I think it's enough. Now you can put the strip onto your blood. And then we have to wait for the result. And while we're waiting, you can hold this alcohol swab. And you can take off the lancet. You can use the cap like this to make it safer for you. And after you take it off, you can throw this into the safety box. Okay, the result has come. Can you read the result? How much is the result?
63.
Okay, that's right. The result is 63 milligram per deciliter and it's normal. So please keep it up. We take your medicine regularly and manage your food. Okay, now I will take the alcohol swab. And then you can take off the strip and these things too. Okay. After you do the blood glucose test, don't forget to write the result on this monitoring card. You have to write the day and date, the time, and the result. And then you have to sign in this column. Okay, ma'am. Do you usually take this medicine?
Yes.
According to your doctor's order, how do you take it?
Twice a day.
Okay, let me explain it to you. So this medicine is called metformin and the dose is 500 milligram. This medicine can help your body to control your blood glucose level. So you have to take it after you eat by oral twice a day in a day and a night. And you should avoid milk while taking this medicine and you should not chew this medicine. Are you understand?
Yes, I understand.
Okay. After this, I will help you to take your medicine. I will check it first. Your name is Miss Christina
Mrs.
and your medicine is metformin 500 milligram. You have to take it twice a day after meal. Okay, it's right. Now I will help you to sit first. Okay. Now you can sit. Okay, now I will put this here and I will take off your socks.
Mm-mm.
Excuse me, ma'am. Okay, now I will check your food condition first. Let me check it. Okay, there is no ulcers here, but your nails look yellowish. That means that your foot don't have a good blood circulation. Can you feel it?
Yes.
How about this? Can you feel it?
Yes.
Okay, that means that your nerve function is still good. Let me do it to your left foot. Okay. Okay. There is no ulcers on your left foot, but your nails look yellowish too. And like I said before, it means that your foot don't have a good blood circulation. There are some symptoms that usually appear in diabetic foot, like discolorations, ulcers, and swelling. And some of them don't feel any touches. And for you, I found a sign of diabetic state, that is discolorations. The normal color is pinkish, but your nails look yellowish. Now, I will put the towel here. And first, you have to soak your foot with warm water. Can you put your right foot first? Okay. It can help to stimulate your blood circulations on your foot, and you can massage it if you need it. Okay, it's done. Can you lift it? And then you have to clean your foot with liquid soap, and you can wipe it with washcloth. From the top of your foot, between of your finger, bottom of your foot until your heels, and then you can clean it with clean water. From the top of your foot, between of your finger, bottom of your foot until your heels, and then you have to dry it with towel. Don't forget to dry the between of your foot because that area are mostly too humid, so it can cause a fungus. Okay, now you can apply a lotion to make your foot still moist. You can apply it on the top of your foot and the bottom of your foot. Okay, now we will do with your left foot. First, we have to soak it with warm water. Okay, can you put in? Okay, it's done. And then you have to clean it with liquid soap. From the top of your foot, between of your finger, bottom of your foot until your heels. And then you can clean it with warm water. From the top of your foot, between of your finger, bottom of your foot until your heels. And then you have to dry it. And don't forget to dry your between of your finger. And then you can apply a lotion, the top of your foot and the bottom of your foot. Okay, now I will help you to apply your socks. You can roll up your socks to make it easier for you. Excuse me. Okay, do you understand about what I have explained?
Yes.
Okay, now I will take it up. Okay, ma'am. After this, I will move you into your wheelchair and I will prepare first. Okay, now after this, I will help you to stand up. You can place your arm here and now you can stand up slowly. Okay, you can go down. Do you feel dizzy?
Mm,
No. Okay, let's walk to your wheelchair. Now you can sit down and you can place your arm here.
mm,
Do you feel comfortable?
mm.
Now I will put on your safety belt. Now I will put on the footstep. You can lift your left foot and your right foot. Okay. Okay, you can wear this to make you feel warm. And you can hold the pillow. Okay. Now I will start to change your linen. Excuse me, ma'am. Can I take the pillow? Okay, thank you. Okay, ma'am. Now I'm done to change your linen. And after this, I will help you to move into your wheelchair. Let me take your blanket first. Let me take off the footstep. And I will take off the safety belt. Now you can put your arm here on my shoulder. And now you can stand up. Do you feel dizzy? Okay, let's walk into your bed. Okay. Now you can go up into your bed.
Mhm.
Okay. Now we have to move your leg onto your bed. I will help you. Okay. Do you feel dizzy?
Mm.
No. Now you can lay down.
Mhm.
Okay. Now I will put on your blanket. You can take off your hand. You put your hand here. Do you feel comfortable?
Mm.
Okay, now I will tidy you up first. And now I will tidy up. Okay, ma'am. Now I have already finished to do the blood glucose test, and the result was normal. It's 63 milligram per deciliter, and I help you to take your medicine, doing the food care, and I also change your linen. And now your linen looks clean and tidy. How do you feel right now? Okay. Do you have any question? Do you need any help?
No, thanks.
If you need any help, you can press this button or you can call us in the nurse station. You will get your next blood glucose test next week on Monday at 7 a.m. Thank you for your cooperations. Good morning. Open up the SCAT cells window and the door. Turn off the lamp. For all the guests, please come in because I have already finished to check the patient's condition. Thank you for your cooperations. Good morning. Bring the tools out from the patient's room. Good morning, judges. Now I'm contestant number 13. Have already finished my task.
Okay, thank you, contestant number 13, for your participation today. Okay, the module is already done and you can have rest, and then we will see you tomorrow morning and you can leave the meeting.
Thank you.